Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose Naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us.
Everybody's going to ask, how do you fix a leaky gut? Well, I wanted to do this because, like I said, I've been in practice a long time. And I take care of people who've been here, there, and everywhere. And, that haven't gotten better. So often when I'm doing my history, which does take about an hour and a half, okay, I'll ask them, have you treated your leaky gut? If they bring it up, and I'll say, how did you treat it? Well, I took probiotics. I said, okay, how did you treat the leaky gut? I took probiotics. Okay, and I wonder sometimes if it's the person reading or their practitioners just don't have the cohesive knowledge. Well, very, very simple. You want to fully digest your foods, okay? And after 35 years of age, most of us need digestive enzymes, okay? And reason is if you break down your foods completely, you'll absorb it. If you break down, let's say, proteins to not the constituent amino acids, but to short chain proteins, those are antigens and they get absorbed and the body responds to them like an antigen. So the addition of enzymes can cure a lot of stuff. It'll lower the antigen load, lower the inflammation. You need to create a mucus layer, okay? Mucus, as funky as it sounds, okay, is where the microbiome live. That's what they eat, and that's where they do their work. It's your first layer of defense. Okay, it also where it traps antigens, and secretory IgA comes over and grabs it and takes it away. You'll see things like fructooligosaccharides, slippery elm, inulin, chia seed, and so forth, galacto-oligosaccharides, xylitol oligosaccharides, and human oligosaccharides. There are lots of different kinds out there, okay? The human oligosaccharides are hellishly expensive, but for those people who are high allergic, it may be useful. But any of these things will help create a mucus layer. They're also under the classification of demulcent herbs. You have to give the body what it needs to repair the cells, okay? And a lot of times you need butyrate, zinc carnosine, glutamine, and the SBI is serum-derived bovine immunoglobulin isolates. I have another slide just on that. The thing I would say to be careful about is that if you have anxiety problems or excitation problems, be careful with the glutamine, okay? Because a lot of glutamine is going to create glutamate. And if you're having trouble converting it to GABA, which is how you calm yourself, you're going to have more excitation. So sometimes you have to do it separately. And then we need a probiotic to reestablish the adequate diversity, and that's a seminar in and of itself. There is something that we use called leaky gut mucosal butter, okay? This has been shown to fix leaky gut comparatively quickly. When I say quickly, I mean 3 to 6 months, not a year and a half. It's a self-blended product, okay? And believe it or not, you can use it. It's very well tolerated by almost everybody, okay? So anybody who has chronic inflammation, believe it or not, this is the best thing to use. I'm going to tell you exactly how to make it. Okay, so extra virgin olive oil, half cup. If you're not dairy sensitive, organic salted butter, a quarter of a cup, suggest you melt it. If you are dairy sensitive, maybe a quarter cup of coconut, almond, hemp seed, anything cold pressed oils. Unpasteurized natural honey, 2 tablespoons. And a lot of people out there saying, what does this mean? At the end of the seminar, at the end of the webinar, there's a list of scientific evidence of all the different things I'm talking about here. Probiotics, maybe 5 capsules of it. Zinc carnosine. I usually use Seeking Health or Pure Encapsulations, 4 capsules of that. A product called Sialex, which is sialic acid, which acts as a mucin. Okay, 4 capsules of that. Butyrate is super important, but if you try and put powdered butyrate in, oh my God, the smell. There is a liquid butyrate out there that from pure encapsulations that works very well and doesn't smell bad. And if you are going to use glutamine, about 4 scoops, okay? But remember, if you have any kind of excitation, it's probably not a good idea. If you have a test that shows you have low secretory IgA, or you've been ill for a long time, add in serum-derived bovine immunoglobulin isolates. That's sold as SBI. Slipping my mind. But anyway, the studies that were done on the serum-derived bovine immunoglobulin isolates show that even people with HIV, this will help their gut to work better. So essentially what you can do is you can put all the stuff in a blender, blend it up, okay, for a couple of minutes, put it in a jar, and put it in the refrigerator. And by morning, you've got a toast. I mean, a butter. You might want to mix it a couple of times while it's congealing. And you can take a tablespoon of that a day, okay, and guess what? Your gut will start healing. I wanted to go through neurotransmitters in a big way because I am the neurotransmitter whisperer, but I think I'm going to ask if I could come back and do a lecture on neurotransmitters and mood disorders because this was getting into a lot of slides, okay? But functional medicine practitioners do test for neurotransmitters. I know there's arguments about it, but I will tell you that they're accurate, especially if you look at it from a biomarker point of view. So just real quick, neurotransmitters are divided into excitatory and inhibitory. This is a great thing called the brain wall that my son is a graphic artist, created, which is color-coded and tells you what areas of the brain do what and who's responsible for it. And you can go to my website and or my YouTube channel and look up the neurotransmitter lectures I've done, and it'll be on there. Excitatory neurotransmitters have to be in balance because even epinephrine, if you have too little, too much, you're going to have nasty symptoms, and especially dopamine. Dopamine's a funny neurotransmitter. I mean, funny, strange, not funny, haha. When it's too low, you can get a really nasty depression called hedonism or anhedonism, which is a lack of joy. But when it gets too high, you can actually get paranoia, psychosis, and other nasty things. Glutamate that we were talking about before, when it gets too high, you can start getting seizures, okay? A lot of times people with attention disorders, okay? There's 2 reasons for attention disorders: a lack of phenylethylamine and norepinephrine, which are responsible for focus, or your brain is moving so fast that you have the attention span of a gnat. You got to figure out which one. And that's why things like amphetamines work for some and not for others, okay? The inhibitory neurotransmitters simply calm everything down. Okay, serotonin is the one we know the most of. And if you have it too high, though, hot flashes, serotonin syndrome, irritability, too low, anxiety, insomnia, depression, uncontrolled appetite, usually for sugar and carbs. There was a book called Potatoes for Prozac. Okay, so somebody who has a craving for chips, or that's in the UK, or French fries in the US, or they're usually looking for serotonin, whereas if they're craving sugars, cookies, candy, they're feeding candida. And since serotonin is the primary neurotransmitter of the enteric nervous system, a lot of times if you're trying to fix a gut, you need to support the serotonin pathway. I would really love to do a long masterclass on neurotransmitters. So anyway, how about we put this together with a couple of case studies? Everybody game? All right, let's see. This case study is Alyssa. I have permission to speak her name, okay? When Alyssa was 8 years old, her mother contacted me because she thought she needed Erlang glasses. And I asked a bunch of questions. She said she had a bad gut upon eating gluten, soy, or almost anything else. But after questioning, and I had her mother question her that night, I found out that the poor little one had auditory hallucinations, visual hallucinations, and olfactory hallucinations. And really, I said to her mother, I said, get a workup done. She said, what workup? I said, listen, you got to get CAT scans, all this good stuff, because sometimes conditions are best treated by other specialists. So her workup at the time, she did a brain CT, MRI, labs for thyroid, and so forth. Everything came back negative. And the thought was, hey, she's having hallucinations. Let's start putting her on antipsychotics. No. So this kind of condition, there's a lot of possibilities. So I started looking at her genetic information. Okay, and we already talked about why. And here was, at the time, Stratagene was not invented. Okay. Actually, the original Stratagene was my idea that I shared with Dr. Ben Lynch. And this is how I shared it with him. Okay, so in this particular case, I showed where in the pathway planners, how, just like mine, her COMT and MAO would back up her dopamine. Okay. Her GAD enzyme, that one that takes glutamate and turns into GABA, was significantly polymorphic. And my suspicion was she had a lot of glutamate, because a lot of times hallucinations are really a seizure activity. B6 is the cofactor. Okay, for those people who may not know, abnormalities in the GABA system have been noted in subjects with mood and anxiety disorders. Her ability to break down reactive oxygen species was compromised, so whatever kicked that up may have had major difficulties. Difficulty in creating methyl B12, and BHMT creates homocysteine, but here's a little clinical pearl for the practitioners. When you see something like this and somebody has chronic dysthymia or trauma, okay, a EMDR, which is a type of therapy, usually works pretty well with them. Okay, transsulfuration wasn't so bad. This is how you create glutathione, and then the glutathione needs to be recycled, okay? She has a tendency to have high levels of immunoglobulins when she has leaky gut, which she did. Okay, and her methylation pathway was significantly compromised. By the way, MTHFR, they usually look at C6, 7, 17, and 1298C. There are 50 MTHFR genes. This one has about 13 or 14, so you can look at it and say, well, this pathway is going to have some difficulties. Okay, when you only have two, it's hard to tell. And when methylation is interfered with, you can have a lot of psychiatric illness. The mitochondria, if you should have difficulty in the first complex, which is this NDUFS, and difficulty with recycling glutathione, the amount of oxidized glutathione will block the entry of what goes in here. Okay, that's as simple as I can make it. So when I was thinking about it at the time, I said, well, she has hallucinations. Here's her SNPs. And my index of suspicion was immune issues, microbial involvement, the downstream effects were neurotransmitter imbalances, and what questions I needed to ask her, what testing I needed to do. The bad gut, again, leaky gut, upregulation of the immune system, dysautonomia, relationship of the systems, her symptoms to food intake, which she already had, and food allergy tests, organic acid tests, and cross-reactivity testing. Again, mitochondrial function, what the suspicion was, what the downstream effects might be, ask about fatigue, lack of ability to heal, which in the fact, she was a little girl that wasn't very energetic, okay, and what testing I could do at the time, and methylation we already talked about. So this panel, if you get to see it, is something to kind of look at and say, how did you look at this differently to help heal her, okay? So my suspicion was she had neurotransmitter problems, leaky gut syndrome, difficulty with aldehyde metabolism, methylation issues, and mitochondrial dysfunction. And how do you use this information? Well, you take a good history. You can work things empirically, but you want to do some testing, okay? So we wanted to search for the root causes. This is a neurotransmitter test, okay? Just so you know, 20 to 80 is considered normal here. This particular pattern where the glutamate is high, dopamine is high, dopac, norepinephrine, this is an immune problem with semi-advanced decompensation. Okay, so she's had it when she first got whatever she had. All of these things were way up here, and they're all on their way down. I teach a course called Dynamic Neurotransmitter Assessment, and with a history, you can tell which direction these are going in. Okay, so the hallucinations were from overexcitation, too much dopamine. Okay, so the adrenal fatigue, given this indicator, one high, one low, it's been around for at least 3 or 4 years. So you need to ask, okay, who upregulated or who dysregulated the nervous system? Okay, leaky gut syndrome will do that just by virtue of the fact of creating a lot of inflammation. And we have to start looking for microbial involvement. I tested her for Lyme disease. Okay. Lyme disease testing can be very, very dicey. Okay. This particular lab, not only did they give me the CDC and alternative criteria, positive or negative, they actually showed me the test. And the test, just so you know what is considered positive, if at this time, if these numbers are 60 or more, then the band would be considered positive. So positive, positive, negative, positive, negative, positive, positive, equivocal, or positive. The problem is when you use regular labs, if all of these numbers are below 60, and let's say all of them, show something, it says negative, but why would you be developing antibodies to Lyme disease, even though they're on the lower side if it weren't there? Okay. Same thing here. And you have IgG and IgM. We're not going to get into that argument. Okay. Where there was no antibodies, but the 23 band had antibodies that were below what would be considered positive. This is just a repeat of the neurotransmitters. So my real suspicion was she had chronic Lyme disease. Plus, she was from Texas. Can Lyme disease cause those symptoms? Yeah. Okay, so we did a lot of testing, and we found that she had Candida yeast. She had HHV6, which is a herpes virus in the brain. She had Lyme disease, and a bunch of food allergies. Okay, so my working diagnosis that was Lyme disease, yeast overgrowth, leaky gut syndrome, and viral syndrome. And what you do at this point is say to yourself, okay, can the leaky gut lead to immune dysregulation that can be a cause of the neurotransmitter imbalances or hallucinations? Yep. Can Lyme and HHV6 attack the neural cells and create the problem? Yep. Can yeast overgrowth increase the levels of basically formaldehyde? Yep. So you get those things together and you say to yourself, if I treat these, maybe I can get rid of the problem. So Sherlock Holmes would always say, if you've ruled out the impossible, whatever's left, however improbable, must be the truth. Remember something. If you tell this little girl she's got schizophrenia, she's going to be on medicines for the rest of her life. And the process that got her there will continue. Because once you make a diagnosis, the investigation stops. If I look at her and say, listen, all this stuff that's been going on with you, it's because you've got really bad leaky gut, you've got Lyme disease, you've got, a viral syndrome, you've got yeast overgrowth, and all that's going to happen with her and her mother is say, what do we do about it? Okay, so this is what we did. By the way, for those people who like to be really technical, you can understand physiology down to the quantum level, but you can only intervene at the global level. So it's real nice that you can understand way down, but guess what? You can only intervene at a larger global level, and that's where foundational treatment came from. Okay, so what we want to do is lessen the traffic. This was dietary restrictions like getting her off gluten and stuff, like things that she was allergic to. Okay, starting the process of cellular and gastrointestinal repair. So I'm not going to go through the what we just did before, but with leaky gut, but put her on digestive enzymes. We put her on herbs. At the time, we didn't have that leaky mucosal gut butter. Put her on phospholipids to support cellular repair, put her on digestive enzymes, gave her the DAO enzyme to help break down histamine, probiotics, and absorbable vitamins and minerals. When I say absorbable, I typically use liposomal. Okay, that's just as that will get in. Okay. Now, after a little while, she was starting to get better, but everything was still, it was better, but not great. So I was co-treating with a integrative pediatrician. And after the GI repair program, the pediatrician wanted to put a PICC line into her and start doing rotating intravenous antibiotics. I found another way of treating it, and I offered it to the parents, the pros and cons, and they decided to go in that direction. And it took 6 weeks, and all of her symptoms were gone. And in 3 months, we retested, and everything was negative. So the sleuthing was worth it. Okay. This is my Alyssa. She's so cute. Okay. At 8 years old. And I kept in touch. This is her at 12, 16. Okay. And she's now in college. Look at that face. Okay. She's an honor student, a star athlete. She's there on yeah. What do they call that when you college is paid for because you're an athlete? Okay. She's a beautiful young woman. I know the family. Okay. And basically her hallucinations were an expression of the genetic predisposition caused by neural excitation and immune upregulation secondary to infections and leaky gut syndrome, all kept going by chronic cell danger response. A mouthful, I realize, but look at what we did. And this is by no means an odd case. Okay, this is something I do all the time. And my colleagues do all the time. And this is worth it. Second, Chelsea. This was a very, very, very difficult case. Chelsea started with febrile seizures when she was 10 months old. I'm not going to read all of this. I just want you to notice that in 1994, she had 4 seizures in 3 years. And over time, she's developed more and more and more seizures. By the time 2006 rolled around, she was having seizures not related to fevers. And she was being treated and appropriately with the various medications that are usually utilized. She'd had MRIs, nothing was working. Okay, as the years went along, the number of seizures increased to the point that she was getting like 100 or 200 seizures a year. This is a lot, okay? They tested her for the C6, 717, 1298C as if that made a whole lot of difference. Okay, they did food allergy testing. They tried a lot of different things, but nobody was putting it together. And the thought was she's going to be like this for the rest of her life. Well, I don't know if you can hear this, but let me show you what we were fighting. This is Chelsea having a seizure. Okay, that's her service dog, cutest thing on 4 legs. And this happened 25 times a month. By the way, the parents were phenomenal. Okay, and I'm kind of glad the sound's not on because it's scary. All right, think about it. This kind of condition, what's it doing to her brain? It's like lightning going through. Okay, so from April of 2019 to March of 2020, you can see that the seizures kept going up. Okay, and I got involved, I believe, the beginning of 2021. And I'll say in a second. But I looked at her genetics, okay, and what I did was just make this very clear because I used 2 different tests, and you can see that she had a genetic predisposition to excitation. Okay, well, guess what? It doesn't tell me what's causing it, okay? And she had a genetic predisposition to high histamine. Okay, so I knew I had to break down histamine. Histamine will rip open the cells. Okay, it is one of those things that's important for neurotransmission, is important for a lot of things, but When it's dysregulated, it can cause a lot of nasty, nasty symptoms. Okay. I looked at her hair elements. Okay. She had a high uranium. I've seen a lot of people with this, a high lead. Okay. And she had a reasonable amount of minerals. By the way, if you're doing hair analysis, you're kind of seeing 6 weeks because what you're seeing what's being excreted. If you're doing metal testing for the serum, it's recent. If you're doing metal testing for the red blood cells, it's approximately a 3-month window, and the white blood cells approximately 6 months. Okay, this is Chelsea's food allergy testing. Notice that the white lines are IgG, and the black lines are IgE. IgE is where you get histamine. Okay, when you have a bunch of things up like this, that's mainly leaky gut. Okay, whatever you're eating, you're seeing. Sorry for the tilt here. Okay, where was she getting her histamine? Well, dairy was kind of nasty for her, as was beef, lamb, and pork. Okay, that was giving you a lot of IgE, and this is where the histamine was coming from. Okay, looking at other tests, her iron was on the higher side, as was the transferrin. A lot of times viral infections will kick up the iron metabolism, okay? And that's a fairly new thing that's on the, this was from 2008, but we're beginning to see that with the COVID patients now, how it affects the mitochondria and actually makes them burst. Okay, by 2019, she was having still a lot of seizures, but this is what you would see with Chelsea. She was very confused. I don't know if you can hear her talking. Sort of walking around like she's making dancing movements sometimes, not exactly all there. Okay. So from February 2020 to February 2021, when I was involved, her seizures went from 22 a month to 4 a month. Okay. And what I did was the foundational treatment using liposomal vitamins and minerals, treated her for leaky gut syndrome, supported the mitochondria, supported the cell membranes a lot because let's face it, guys, those seizures were ripping that stuff apart. She progressed slowly. A lot of times it takes time. And the hundreds or thousands of seizures made significant damage to her central nervous system. There was no single root cause that I could find. As a matter of fact, I brought this case to my my advanced practitioner group that is meets fortnightly, and they helped me with some of the points of view and also made some suggestions for treatment that actually accelerated her healing. So I want to give a shout out to my group and thank them again. But sometimes if you don't know what's going on, what you should be doing is getting the cells and biochemical pathways optimized. Vitamins and minerals that get absorbed into the cells. Make sure you're getting phospholipids in. All the things you would do to make sure a cell works. So in mid-2021, this is Chelsea playing cards. You notice she's still a bit shaky. But she's able to think. As the seizures decreased in number, she started healing. If she didn't have what she needed to heal, she wouldn't have. And in late 2021, I got this great movie.
Hi. Chelsea, making applesauce.
And I think you can see that she's pretty well with it now. Okay, this has taken 2 years. Okay, and this is Chelsea. She's 27 now, and she is one beautiful girl. One of the earlier meetings I had with the parents, and they were always there, Chelsea was sitting there and said, "You have really pretty eyes." And she went like this, looked right, and I knew she was in there. Okay, and these parents were incredibly dedicated. So I got this card from them, okay, last Christmas. And I cried for about a week because it makes it all worth it. So the fact is, people, if we think differently and work together, we can change lives. We can change a lot of lives. But it does take a combined effort. So, as I promised, tips on how to pick out a practitioner. Here's some words of wisdom. Listen to your patient. He's telling you the diagnosis. Sir William Osler, one of the founding fathers of Johns Hopkins Medical Center, said that in 1895. So my joke here is that in real estate, it's location, location, location. In healthcare, it's history, history, history. You want to find out what's wrong? You need to take a history. And you got to treat the patient, not the test. So when you're looking for a practitioner, you kind of want to go on that reputation. So here's how you can pick out a good practitioner, alternative medicine practitioner, okay? Because a lot of this complex stuff you can't do by yourself. If they have certification beyond their original degrees, if they have an eclectic knowledge base, okay, so you're given true holistic care. In other words, as soon as they're disparaging the other side, in other words, if they're not willing to work with allopathic medicine, or they don't have enough experience and they're stuck in their little paradigm, that's where there's problems, okay? If they're focused on finding the root causes and all the downstream effects, creating and will create an individualized manner of treating you, not your condition. The real trick here, guys, is that they have to treat you, which is your attitudes, and kind of coach you through everything, and not your condition. You are not your condition, okay? They have to use lab tests appropriately and know how to interpret, not just read them. Anybody can read a test. The companies show you what the test means. But a good practitioner knows how to put it together and knows how to target testing. Because let me tell you something, testing can be very expensive if you're paying for it. And throwing out a net and seeing what you catch is not usually the way to do it. You have to target it. And they'll take the time to listen to you and explain things to you. So I really suggest that you interview any practitioner before committing yourself to their care. And what are you doing in the interview? You want to assure yourself that he or she is committed to your healing, and are willing to take the time and effort to return you to life. Okay? And that's super important because chronic illnesses do take a long time to heal. A magic pill does not work, does not exist. If you're still looking for the magic pill, I'm sorry to say, you're going to be stuck for a long time. So you need to work with a practitioner, embrace the healing process, participate in your recovery, and you will heal. You will. I've got so many cases that nobody said would heal, and they are, okay? Here's some resources for you. For the nutritionists who work with the LDN Research Trust, who are all the kind of practitioners that I just mentioned, this is the link for them. If you're looking for a very simple book, which is the one that Elizabeth and I wrote, which is called Leaky Gut, Leaky Cells, Leaky Brain. It's available on Amazon for Kindle, and you can get the book. It's also available in Japan. For the testing for the practitioners, if you're in the United States, Rupa Health is the best way to go because Rupa Health has all the various companies under their roof. So for the same prices, you don't have to go to 14 other companies. You can have it all in one place and they'll do all the work. In the UK and EU, you can access functional diagnostic, which is Jonathan Cohen's. This has all wonderful, wonderful functional testing. And the program it goes through is phenomenal in its explanations. You can go to Biolab UK or Regeneris Labs. Okay, and all these guys will work in the UK and the EU. There are places in Australia. Anybody can contact me at any time if they need help, any practitioner to figure out where to get testing or how to interpret it. These are some evidence-based references that I promised you before. Whoa, there it is. By the way, this stuff doesn't have to be exceptionally difficult. You can learn this stuff by going to YouTube and going to science music videos. And The teacher that does this, I swear I learned a lot of this stuff just by listening to him. Okay. So you might want to, if you kind of got confused as to what an enzyme does or what the heck am I talking about? Okay. They have music videos that are incredibly simple and accurate. Okay. Again, I'm Dr. Jess Armine. I do treat patients and mentor practitioners throughout the world. I do offer prospective patients a complimentary 30-minute get acquainted session. They just have to go to my website so they can interview me. And the House Armine, Heal the Sick, Feed the Hungry, Shelter the Weak, and Shelter the Weary, and Defend the Weak was my Father's Day present from my graphic artist son. So thank you for letting me babble in your direction. And I'm going to be really happy to answer your questions now. Okay. So what is this doing in integrative and functional medicine? Nothing. Okay. Integrative, functional medicine, think of it as the alternative medicine practitioner. What I would really like to see is an integrative medicine center. Now, not one person, not one professional can be integrative. They like to think so, but if you've been an MD or you have an allopathic background, you're going to tend to think that way. It actually takes a blending, which is going to take more than one practitioner. So that's what I was alluding to. Do you have any suggestions for increasing serotonin and norepinephrine to help with chronic pain without taking an SNRI? Sure. If you want to increase serotonin, you can either use L-tryptophan or 5-hydroxytryptophan. Now, here's something that you have to be careful about. L-tryptophan, if there's a lot of inflammation, which if you have a lot of pain, you do, okay, can get pulled into a different pathway called the IDO pathway. Don't worry about the words. And create something called quinolinic acid, which is a hell of an excitotoxin. So 5-hydroxytryptophan is a little further down the pathway and goes directly to create serotonin. Now, if you're going to do that, I'm going to suggest very strongly that you start slow, like at 50 milligrams a day, and then work your way up slowly. And you can increase your serotonin that way, okay? Norepinephrine in that pathway, the pathway looks like this. Phenylalanine to tyrosine to L-dopa, dopamine. And that creates dopamine, which then gets broken down to norepinephrine, then epinephrine. The critical enzyme that does that is dopamine beta hydroxylase. And you need PQQ, vitamin C, and copper to run that. Okay. So if you're going to raise norepinephrine, okay, and I don't know why you'd want to do that specifically, okay, but if that's what you want to do, the best way to do it would be with tyrosine. Most people use about 500 milligrams a day. But it's really helpful if you get your neurotransmitters tested so that you know where the balance is, okay? Chronic pain can have a lot of sources, okay? A lot of sources. And you might want to take my little hint about leaky gut because that's going to cut down inflammation big time. Pain is always inflammation, but that's the way you do it if you were, going to go about the way you asked. Can we receive a copy of the slides? Yeah, of course. All right. Okay, the substitute for honey for someone who's allergic to honey, just leave it out of the recipe. Okay, honey does have a bunch of healing qualities, okay, but if you're allergic to honey for whatever reason, it's not critical, okay? That's the nice thing about that, leaky gut mucosal butter is that there's a lot of variations you can put in, okay? So just leave it out. It's not a critical component, and you'll still get benefit from it, I guarantee it. That's it. Do you use palmitoethanolamide? Yes, I do. Palmitoethanolamide, PEA, if I'm pronouncing it right, took me about 3 weeks to get to pronounce it, is an anti-inflammatory that's fat soluble that works differently than other anti-inflammatories, and it works very, very well. I usually recommend 400 milligrams 3 times a day. It's also available everywhere, okay? It does take a little time to work, but it works very, very, very well. Again, like anything else, if it's not helping, then you have to critically look at it and say, okay, what is this treating? Okay. And if it's not hitting you got to look at something else, sort of like taking LDN, which works with the toll-like receptors. It's not for everybody. All that means is that where your inflammation is coming from may not be from that area. So or when I'm chelating heavy metals, especially mercury. I'll always tell people, look, if mercury is the big deal here, you're going to see wonderful improvements. If it's only part of it, you're going to see partial improvement. If there's none, there's going to be none. Okay, so I've had very good experiences with it. The light thing I like about PEA is that it's not one of those things that can hurt somebody. Okay, can you talk about how you would approach trying to reverse central sensitization? I'd like you to explain central sensitization for me, if you could do that, so I can answer that specifically. So does it matter if one has a slow or fast COMT to contribute to the slow breakdown of glutamine into GABA? Not really. Okay. I know Dr. Ben has changed it from homozygous to heterozygous and what's slow and what's fast and so forth. The whole thing is you have to realize that you were born like that. So it doesn't matter whether it's slow or fast. You still have to do the same thing. You still have to supply the cofactors, look at why you're not breaking glutamate into GABA, which is usually B6, by the way, okay? Because COMT doesn't enter into that pathway. But downstream of that, it will. So your short answer is using B6 or P5P and look at your sources of glutamine. Like if you're trying to heal your leaky gut and you're pumping in 4 to 7 grams of glutamine a day, stop, okay? Use something else, all right? Like this serum-derived bovine aminoglycosides list. That will help a lot better. So honestly, I would just think about B6 or P5P. Is there a place to further research the risks of L-glutamine for leaky gut? How long at most would you suggest taking this? Well, you don't really have to research. You can just do it. You can if you want. All right. L-glutamine creates glutamate. All right. Glutamate is a very excitotoxic compound. All right. When it's too high, you'll get seizures. If you're taking glutamine and you feel worse, there it is staring at you in the nostrils. Now you could add B6 to see if it'll help the pathway work. And if it doesn't, I would abandon the project and go about fixing the leaky gut a different way. All right. How long would I use it? Well, how long would you use? I'm sorry, if I'm reading this right, is there a place to further research the risk of L-glutamine for leaky gut anxiety? If it's causing anxiety, just stop, please. Okay, because you're adding to the problems. All right. You can, there are GABA supplements out there. The better ones that are available would be from Quicksilver Scientific, which is a liposomal GABA, which we'll get into the brain very quickly. The problem with benzodiazepines and stuff is that they will stimulate the GABA A receptor, and that's where damage occurs. So if you can give somebody GABA that just gets into their brain, then they'll have GABA to use while you're fixing the physiology, okay? And when you say how long at most would you suggest taking this, are you asking about the glutamine? I hope I'm answering the question correctly, or I hope I'm asking the question that is being asked, okay? And let me just bullet point it. If you're taking L-glutamine and you're getting anxiety, stop. It's not that critical. Okay, there are other ways of fixing the gut. If you're taking L-glutamine and you insist on continuing to take it, then take B6 with it to make sure because that's the cofactor for that enzyme. If you're still having anxiety, please stop. Okay, I'd rather you not take glutamine than take something else for the anxiety. I would stop the glutamine, okay? Look at the leaky gut ingredients, just leave out the glutamine. There's plenty in there to fix the leaky gut. And glutamine by itself should not be used to fix the leaky gut. There are many other parameters, okay? So I hope I answered that. Okay, done. I hit the done button, right? 5-HTP is very difficult for people with COMT SNPs. Any other suggestions? Well, let's not get into what causes what. The fact is that 5-HTP can be difficult for people if you use high amounts. And the reason for it is that the serotonin receptors tend to be atrophied. So you have to tease them up a little bit. And that's why I use 50 milligrams a day for a week or two and then 100 milligrams a day and so forth. Now, if you can't use the 5-HTP at all, then the only other choice is to use L-tryptophan. Okay. And yes, I know it might go down the other pathway, but simultaneously, while you're treating somebody, you should be working on their leaky gut or working on the inflammation. As the inflammation drops, it's not going to be stolen or pulled into that other pathway. Okay. Just know that L-tryptophan, only about 10 or 15% of it becomes 5-HTP, which actually works for some people because they get their serotonin a bit slower. Okay, submitted my saliva to Strategene. Do you interpret these? Yeah. Well, I interpret the the Strategene test. So you could just contact my office and make an appointment for that. What's the best way to go about learning interpreting? You might want to call, if you're a practitioner, you might want to call me and I'll or contact me and I'll chat with you about it, because it's not as hard and it's not as easy. It's a matter of learning how the pathways work. Okay, I'd be happy. That would be another 2-3 hours of explanation. I'm not trying to avoid you. Just, you might want to just have me interpret yours, and I'll show you how to think about it. Because once you know how to think about it, it's easy. Do you suggest a specific probiotic? Do you recommend Strategene or the specific testing? Okay, my recommendation for probiotics is individualized to my patient's needs, okay? That's the benefit of knowing the different probiotics. When I don't have a particular, if somebody says, gee, what's kind of a good general probiotic? I like something that has a lot of lactobacilli and bifidobacteria. One of the better probiotics out there. All the probiotics made by Seeking Health are wonderful, okay? I do tend to use Megaspore Biotic, okay? For some reason, it roots better. But it all depends on the individual. Strategene or other specific genetic testing to understand the pathways. Strategene is the better one to use because they put the polymorphisms into the pathways. It's a little complex to look at, but if you take your time, it's easy. There are other tests out there. They don't put it together, and they don't put it together in the pathways. So you don't have a good feeling for, what actually is going on, which I know stinks. And the ones like Tree of Life, no, I shouldn't say it, that point directly to product, you have to be very suspicious of, because the information is being geared towards selling products. So they're going to skew the data. Okay. And I detest that. Strategene is your better middle ground. Okay. MTHFRsupport.com has a wonderful report with about 1,100 genes, but you really have to understand where they go and what they do. Otherwise, it's going to be incredibly confusing. And I realize Strategene's a bit on the pricey side, but it's worth it. Which neurotransmitter test do you prefer and why? I always love this question. Okay. Understand that neurotransmitter testing, be it urine, serum, platelet, is all not CNS, central nervous system. It's going to be a combination of central nervous system, peripheral nervous system, and whatever. So whatever test you use, and I tend to use urinary neurotransmitters, okay, are to be utilized as biomarkers. In other words, looking at the pattern. Looking at the pattern will give you an idea of what that patient may need, whether you're using nutraceuticals or pharmaceuticals. Okay, if the person has very little serotonin and everything else is, like the dopamine's on the higher side, well, you're going to want to raise serotonin to bring down the dopamine because they counterbalance one another. Whether you do that with tryptophan or 5-hydroxytryptophan or an SSRI, that's part of your practice. There's loads of companies out there that do neurotransmitter testing. I tend to use Vibrant Labs. They're neurotransmitter advanced because it has the cortisol and not only the neurotransmitters, but the metabolites. Okay. Again, feel free to call me and I can answer that in in a more complete manner. I've taken care of have I seen many mast cell activation clients? Yeah. And it is on the rise. And one of my theories is that it's the environmental toxins that's dysregulating the cell membranes of the cells plus the mast cells. So they tend to degranulate with very little, impetus. So in order in order to fix mast cell activation disorder, you do the same thing as fixing the other cells, okay, which is roughly fixing the leaky gut, because whatever's going into the gut, it's not just fixing the gut, it's fixing all the other cells also. And it is on the rise. Mastocytosis is not mast cell activation disorder, but a lot of the histamine issues. If you look at the genetics, you can help by looking whether they just need DAO, if they need support. Histamine, the external pathway outside the cell, DAO, aldehyde dehydrogenase, and then it goes out as acetic acid. The internal is HNMT, MAO, A and B, and then the aldehyde dehydrogenase is an out. So Seeking Health has a product called Histamine Block Plus. If you were going to shotgun, that has all the cofactors and everything you need for both pathways. But it is on the rise. And if you just do that, you'll help the breakdown of histamine, but you're not going to do much for the mast cell activation disorder. So you have to kind of back up and say, why is this happening? I have Hashimoto's and on LDN, which has helped me get great sleep, but I have hair loss, possibly alopecia. What might it take? Well, I don't think LDN by itself causes hair loss. I think you have something else going on. Something, if your inflammation is dropping, most probably you should look at the trace minerals. Okay, trace mineral lack will cause hair loss. Okay, especially in a woman. Okay, thyroid. You have to look at the other parameters also. Okay, LDN's wonderful, and if you're doing well on it, that's great. But like anything else, it's not a panacea. Okay, you have to look at the whole person. Kimberly. Okay, do you treat patients with individual liposomal vitamins and minerals, or they're a combination product? The combination product is called Prodovite, Prodovite. It is made by Victory Nutrition International. Looks like that. Okay. And it is a concentrated multivitamin, multimineral with proligna, which resets receptors, encased in a liposome called a proteasome, which is the strongest on the planet. And I've been using it for decades. It gets into the cells in 5 minutes. It is the only liposomal product that will hold minerals. Okay. There are loads of other options, but if you're asking for that particular, that works. That works very well. High ferritin with normal iron levels and inflammation, if without the major diseases, any solutions to lower ferritin? Well, I would look very much at any viral illnesses. I would start thinking about lactoferrin. Okay, lactoferrin will help lower the iron. Okay, lower the ferritin. It depends on how high we're talking about. Okay, when you see that, a lot of times you're talking about viral illnesses, and they're starting to deposit the ferritin into the mitochondria, and that's one of the reasons for mitochondrial dysfunction. Done. Is whole genome testing within used in your practice if a person comes in? All right. Is the whole genome testing with provided interpretation at the time and when the science comes out used in your practice? Are you talking about a genome or epigenome? Okay. The epigenome is what we work with. It's what's, affected by the environment. Other types of genetic testing for the genome, you're kind of looking for, additions or deletions or, things that cause strange diseases. So if a person either comes with it already done or gets it done through you. I use epigenome. If I use genomic testing in my practice a lot. A lot of times people come to me with it, so I can read them all. Okay, it doesn't. I don't have a particular one that says, "Oh, you have to get that." Okay, sometimes they'll have a 23andMe with nothing, and I may run through a different program because for my own edification. But if they come to me with genetic testing, I put that into consideration of their treatment. How can we easily test mitochondrial function? You can't. Okay. No, I'm not being facetious. Okay. Right now, the AONM in the UK has mitochondrial testing. Okay. But unless you're a practitioner and you know what you're doing, it's going to be expensive, and you have to know what you're looking for. Okay. And it's funny, I was just about to ask someone, Jillian Crowther, if I could get those tests in the United States. Okay, because they're very important. Nevertheless, it's not an easy thing to get. It's usually expensive, and what's worse is you really need somebody who knows how to read them. Okay, knows how to interpret them. So I can, but they're not easily gotten. Where you go to aonm.org, and that's where you're going to find the information. Okay. How do you or others do tests for neurotransmitters? The tests for neurotransmitters are usually done by urine, and there are various companies that do it. Labrix, Vibrant Labs, a bunch of companies, and they will test the actual neurotransmitters within the urine. There's some companies that will test neurotransmitters in platelets. The serum neurotransmitters are also valid, but the urine ones are adequate. They're easy to get, and you'll get a good idea of what the balance of neurotransmitters are. MDL labs only one band above 60 at 94, band 41. Would I have Lyme? Been having gut issues since 2014. Liz, if you have one band, or I'd like to know what the other bands look like, but let's say, for argument's sake, that there was only one band, the 41 band, that was high. That indicates you have co-infections, okay, that you have to look for. You might have Lyme, might have to look at the whole test, okay, but if you've had gut issues since 2014, that needs attending to, okay, because that's where your inflammation is coming from. And maybe repeating the MDL test and looking for co-infections. Okay, MDL, I like MDL a lot. Okay, they're not, if you're paying for it yourself, they're not super expensive, different from IGeneX. If you really want to know a lot more, you would consider Armin Labs in Germany. They do very good testing, rather expensive, but very good testing. And again, you want to work with a practitioner because picking out the testing is important and interpreting it is even more important. Hope I answered your question. Do you find that recent elevation in general societal exposure to EMF has significant effects on our systems, and does it affect healing? Absolutely. Okay, listen, the more sick, is that English? The more people are exposed to environmental toxins, including EMFs, the more it affects healing, okay? Especially when you have chronic cell danger response, because as part of that, you're unable to get rid of your heavy metals, okay? So you're breathing heavy metals all the time. If you look at somebody's heavy metal test and you see a lot of things up that are, where they get this, it's coming from the air. And since the cells can't get rid of it and there's more metals, they're going to conduct the electromagnetic fields in their bodies more, okay? And on the other side, the electromagnetic fields that we're being exposed to are getting stronger and stronger and stronger. You can get an EMF detector for your house and find out where the hot spots are. And they do sell these little, these cloths that you can put over things and over the router and so forth. okay, that will cut down on it, which is usually worth doing. Simple things like not charging your phone by your bedside near your head. Okay, should be about 15 feet away. Not having the router in the bedroom. Okay, turning off your router at night is always a good idea. Unless somebody's doing something, there's no reason to have it on. But it is affecting healing. It's not the only thing, but it's one of the environmental toxins that are out there. Does PEA increase dopamine? Not that I'm aware of. Okay, I may be wrong, but not that I'm aware of. And should you be avoided if your dopamine is high? Well, think about this. What causes the dopamine to be high? Okay, it's because of chronic inflammation. Okay, so if we can knock down the chronic inflammation, or at least use this as a Band-Aid for a little while, okay, the dopamine will drop. Now, mind you, I said the word Band-Aid. There's no dishonor in using a Band-Aid. The dishonor occurs when all you do is use a Band-Aid and you never look for the source of bleeding. So if you constantly, it's like giving somebody 5-methylfolate or methyl B12. That's a Band-Aid. You're not fixing anything. Okay. And if you keep using it, all you're doing is saying, hey, I'm going to sell this patient methyl B12 for their whole life. They don't need that. You've got to fix the pathway. Okay. So I don't know that I would avoid it if your dopamine is presently high, because dopamine is part and parcel of the inflammatory problem. Of course, if you start taking it and you feel worse, you stop. Okay. Let's make sense. Please spell PEA on full. I'm sorry. Palmitoethanolamide. Good luck. High lead levels. Okay, well, there is the chelation. When you say chelation challenged, there's a couple of ways of getting rid of heavy metals that aren't nearly as tough as using things like DMPS, EDTA. There is a product called Toxin Pole, which has cilantro and trace minerals. Sometimes you can just treat with heavy trace minerals and use a binder. That's one way. There are some experimental things out there that I am not allowed to mention that I tend to use that work very well. I would avoid straight chelation. Okay, there are gentler ways of going about it. If this is a real challenge for you, you might want to give me a call or send me an email, so I could be a little bit more specific. Okay, but high lead levels are not overly difficult to treat. The problem is they're in the brain, especially with a kid. You got to be real careful about how you treat it because you don't want to create any more problems. The just neurotransmitter is not test for. I'm sorry, Barbara, I don't understand the question. I have to go back to, only because I'm answering them one at a time. Does GABA help reduce anxiety? Yeah, absolutely. Okay, GABA, gamma-aminobutyric acid, is what the mammalian brain uses to calm it down. The difficulty here is when you're taking a water-soluble GABA, if it does, and it's out there, pharma GABA, a bunch of things. A lot of times that doesn't cross the blood-brain barrier. And if it doesn't, then you may not have the decrease in anxiety you're looking for. On the other hand, if that kind of product does cross the blood-brain barrier, okay, yes, you'll get decrease in anxiety, but you also now know that you have a leaky blood-brain barrier, which is usually viral in origin and so forth, which has to be addressed. Now, other ways of getting GABA into the brain these days is to use a liposomal product, okay? And there's a couple of companies that make liposomal GABA. One makes liposomal GABA with L-theanine. L-theanine will cut down on glutamate, okay? They used to be able to get phenylated GABA, which is also known as Phenibut, but the FDA pulled that off the market pretty good. And I had been using it for years without problems, but it's near impossible to get these days. Mandy, you're going to have to contact me personally because I'd have to get a few people together for that neurotransmitter course. And I am going to be doing a master course on mood disorders and neurotransmitters for functional DX pretty soon. So yeah, just contact me. I'll be happy to talk with you about it. Does glutathione affect methylation, or methylation affects glutathione? Let me answer it this way. The body is simply intricate and intricately simple. Okay, everything affects everything. All right, if methylation is not working, okay, depending on where, you're not going to be able to create your phosphatidylcholine for your cell membranes. You're not going to be able to create muscles. You're not going to be able to do a lot of things. Okay, you're not going to be able to turn on and off all the genes because your methyl donor, which is Sammy or Sam, goes around and puts methyl on different places so that certain genes work, certain genes turn off, and that's the way it's supposed to be. Your glutathione pathway is partly creating glutathione, which is GSH, and then when it's used up, it creates oxidized glutathione. That's the end point. It's called GSSJ. But the great power in his infinite wisdom gave us a recycling mechanism that took that oxidized glutathione and would be able to recycle it back to the active form. Okay, so that's important. So if you're unable to recycle and you have a buildup of the oxidized, that's going to block the entry of what's called the electron donors into the mitochondria. It is the main reason for mitochondrial dysfunction. That was discovered by myself, Sean Bean, and Ben Lynch about 10, 15 years ago. We saw that relationship. So when we started treating that, a lot of mitochondrial function got better. How that was treated, because NAD, that's an NAD-dependent pathway. You can either use NAD or B3. But you have to be careful with B3 because too much B3, you can hypomethylate somebody. I told you it's complex, okay? Also, superoxide dismutase and how it creates hypochlorous acid is part of that pathway. Okay, there's a lot of interactions between that pathway. So they all interact with one another, one way or another. Okay, so that's why you can't treat one thing. You can't treat the methylation pathway by itself. You must look at the entire person. And if somebody tries to be a specialist, I'm a methylation specialist, walk out the door. Okay, because if all they have is a hammer, everything looks like a nail. Okay, we don't need any more specialists. We need generalists. Okay, if they should see a naturopathic versus an FMP, interview them, see who you feel the best with. A good naturopathic doctor has got an eclectic background. A good functional medicine doctor's got an eclectic background. Okay, who do you feel best with? Who's got your best interest at heart? Okay, you can look at it from a specialty point of view, Joanne. Okay, young adult stubborn candidiasis, also histamine intolerant, lifelong eczema, low sugar diet, plus treatment with nystatin, and it's not effective for candida. Any broad ideas? Broad ideas, I've got tons of them. Know what to expect, but thought you may have this type of case. Wow. All right, if you're already using nystatin and you're already on a low sugar diet and the histamine intolerance, this is all leaky gut or leaky cell stuff. Okay, there's loads of things that can be used for candida, but you got to fix the gut first. Okay, otherwise you're just going to make somebody very, very sick. If you're looking at the genetics, DAO may not be the reason that they can't handle histamine. Okay, it could be something else. It could be the aldehyde dehydrogenases. Maybe the candida produces acetaldehyde, which is formaldehyde. Okay, and if they can't break that down, okay, think about having formaldehyde in your system. So what's happening here is that you're shooting at individual targets. You take a step back, start healing the gut, start healing the cells, okay, and then go after the candida a different way. By the way, you want to get rid of bugs? Best way to do it is make the environment inhospitable for them. Okay, candida likes a nice acidic environment. So look to make somebody alkaline. Besides, if somebody's not alkaline, they can't run their entire Krebs cycle and mitochondria and so forth. There's a lot I could say about this, but you're doing the obvious things. And if the obvious things aren't working, you have to step back and say, okay, what else can I do? And in a broad sense, I'd be looking to fix the gut. And maybe if they have the genetics, look at what else. This is a young adult. If they drank alcohol and they get drunk very quickly, like they're a cheap date, that means they've got too much aldehyde. Okay. So looking at what the cofactors for the aldehyde dehydrogenases are. Okay. Those are some of the things you can do. Sorry, I can't give you like a super specific answer because believe me when I tell you, I ask a lot of questions when I'm treating somebody. Do you find recent elevation in general cellular is significant on our systems and does it affect healing? I.e., do city dwellers provide greater difficulties than country folk? Yeah, they do. Is it EMF? Is it the stress of being in a city? I'm from New York City. Oh my God. Okay. So city dwellers sometimes have worse problems. Country folk have a problem with trace minerals if they're on farms, parasites, okay? And the biggest problem with country folk, if they're anywhere near farms, is glyphosates. Everybody's got their problems, okay? I personally don't see one over the other because my practice is very specific for that 3 or 4% of the people who are not getting answers elsewhere. Okay, so it may be just because of my population. I think I answered the dopamine thing with PEA already. Okay, suggestions for biotoxin illness mold. Do you think it's critical to move? Yes and no, Dan. Number one, if you have a lot of mold in your house, you've got to get rid of it. There's ways of doing it without having to do mold remediation, depending on how bad it is. If you're in the United States, you can use something called concrobium, which is available at Home Depot, and you can rent the fogger and get in your basement and fog the whole inside of the house so you can kill all the mold that way. Okay, it works really well. If you do that, and then you can start the process of pulling the mold out of the body, which is basically utilizing glutathione, kidney and liver support, and a very, very good binder, okay? It depends on how bad it is and how bad the person is, okay? Really, if the person's suffering horribly, then you may want to move out temporarily. It all depends. I mean, that's a tough question to answer. It isn't critical to move, but what is critical is the source of mold has to be eradicated. Otherwise, the individual will never get better. All right, no problem. The Victory Nutrition product, it's called Prodovite, Prodovite. Okay, for Pauline, that was the same answer. Well, thank you, JD. I appreciate your kindness. The probiotic I showed on the screen. Did I show a probiotic on the screen? I think this was Prodovite as I showed on the screen. Hold on. Here you go. Yep. Okay, Philip, I just got one word, palmetto. Oh, thank you. He spelled it out for us, palmettoethanolamide. Thank you. How do you find a reasonable Lyme doctor that knows about cow infections? I'd say go to iLads, but I'm not sure. Sorry. If taking a reasonable amount of methyl B12 and methylfolate does increase their dose, does increasing their doses help? The first thing I ask is, does taking the methylfolate or methyl B12 help at all? Okay, I mean, depending on what it is it's helping with. Okay. In other words, is it doing anything good? So increasing the doses may or may not be helpful. But if you need to increase the dosage, you got to ask yourself, am I helping the pathway? Am I fixing the pathway? What's wrong? So that's where I would go with that. Kimberly, I would be interested in taking a neurotransmitter course if you'll be teaching one in the future. Yep. Just go to my website or go to office@drjessarmine.com or jess@drjessarmine.com. Just let me know you're interested, or let my assistant know you're interested, and I'll talk with you personally about it. I'm using GABA cream, which is rubbed behind the ears to bypass digestion and enter the brain via the vagus nerve. Vesta, if it's helping, it's helping. That's something I haven't heard of before. It's called Somnium. Okay, I'm definitely going to look it up and see if it would be helpful for my patients. I appreciate, I learn a lot from my patients and other people, and I have no ego when it concerns my patients. I have the ego the size of Cincinnati, of course, but no, seriously, I love learning things. Thank you very much. Cystic adult acne with leaky gut. Yeah, almost all skin conditions are leaky gut. Okay, and if you haven't treated leaky gut and you've got a skin condition, ask yourself, will I hurt anybody, including myself, by treating a leaky gut, by giving myself digestive enzymes and demulcent herbs and stuff like that? The answer is goose egg. All right. But if I don't treat the leaky gut, whatever the inflammation is doing is going to continue. So if you took a test for leaky gut and you said you didn't have it, you probably have it. Okay. And it's one of those risk benefit things. Okay. I think I answered that already. You mentioned autistic several times. Do you have much success with healing? Yeah, I have a very, very high level of success with autistic children. You're most welcome, Danielle. JD, you're most welcome, brother or sister, whatever. Yeah, mold spores can travel through drywall, but what usually happens is houses have, air currents. Okay, so the mold grows, the spores go through the air currents, and they kind of shower somebody. Okay, that's usually what happens. Okay, you're most welcome, Philip. Pilar Hoffman. Where do you buy? Amazon. You can buy Protovite from Victory Nutrition International, and I think it's vnilife.com. You don't have to sign up for their multi-level marketing thing, but you can become a preferred customer and still get the discounts. Okay. If you have difficulty with it, just let me know. Be happy to help you out. This is a very good, excellent product. They make really good products, seriously. Can I suggest a good digestive enzyme? There's a ton of them. The one I tend to use the most Vesta is made by Now, and it's super enzymes because it's got betaine hydrochloride, pancreatin, oxbile, and a whole mess of vegetable enzymes. Okay, and I get the capsules, and I take 1 or 2 per meal. That's one of the general ones I use. Pempeak. Is scleroderma morphia caused by leaky gut? It's possible. Okay. Again, if you treat leaky gut, are you going to hurt anybody? Is there any risk to doing it? No. If you treat it and it gets better, it may be a component. It may be the whole reason. Okay. Is it going to hurt to try to treat leaky gut and see what it does? Okay. I just keep telling you that it's not a bad idea. Pauline, when can you get an Nth Fr test? You can get them from anywhere. If you're just going to test for Nth Fr, LabCorp, Quest, they all do it. Okay, not going to tell you much, but I would really suggest that either you get Strategene so you can see the whole pathways, or at least if you did 23andMe or Ancestry.com, you'd have to get their raw data and put it into another program, probably mthfrsupport.com. That program with data costs about $39. But honestly, the Strategene is going to be your best bet. Okay, unless you're just looking for the one polymorphism. Acne treatment, this is a young person who is scarring. Again, if you treat the leaky gut, you're going to start getting at the reasons for the acne. Okay, you get part of that is going to be helping the pathways drain and so forth and so on. So you can stop that process. The scarring may be a bit of a bear to get rid of, but you can stop the process. At least that's a good start. I got all the questions done.
So thank you very much, everyone. We really appreciated your company, and thank you for an excellent talk, Jess.
Thank you very much for having me. I really appreciate it. And the last question is, will ulcerative colitis be helped by leaky gut treatment? Yeah. Well, take care, everyone.
Thank you. Bye, everybody.
Thank you for listening
Bye-bye.
to my babblings.
Any questions or comments you may have, please email me, Linda, Linda, @ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.